Knock, knock, knock.
Hi, come in.
Hello. My name is student nurse Esther, and today I will be assessing your head to toe assessment. I'm going to provide privacy. Wash my hands. Can I please get two identifiers?
1999, Iman Sulaiman.
Perfect. So I'm going to ask you a series of questions before we start the assessment. Where are you today?
I am in Trinity University.
Okay, and what's the year?
It's 2025.
And what season are we in?
We are currently in fall or spring.
We're in spring.
Yeah, we're
Okay.
spring.
Okay, just checking. We're in spring. Okay, and what's your height and weight?
My height is 118 and my weight is 118, my height is 5'3".
Okay, so your BMI will be of range around 19, so that's good. What are your usual eating habits?
I believe I eat pretty healthy.
Okay, and how many times do you have a bowel movement?
Probably 3 to 2 times a week.
Okay, and are you experiencing any pain? If so, on a scale of 0 to 10, what would you rate that pain?
No, 0.
Perfect. So I'm gonna go ahead and take your vital signs, if that's okay.
Yes, ma'am.
Okay, so while I'm taking your vital signs, I'm gonna go ahead and put this pulse ox on you and take your temperature at the same time.
Okay.
Thank you. Okay. Okay. Blood pressure is 110/70. And as I was doing that, I was also counting your respirations, and that was at 16. Thank you very much. I see that your pulse ox is at a 95. So perfect. I'm gonna go ahead and take your temperature really quickly. $97.5. Perfect. So I'm gonna go ahead and do your inspection of your head. I see that there's no masses and I see no infestation, so I'm gonna go ahead and palpate. And while I'm doing this, do you feel any tenderness? Okay, perfect. I'm gonna go ahead and take a general look at your skin. I'm gonna do a skin trigger, and I see that your skin goes back into place, so that's a good sign of hydration. I also see that there's no edema as I'm pitting your fingers, and I also see your capillary refill, and it goes back less than 3 seconds, so that is good. Your skin, I see that it's of normal color, no pallor, no cyanosis. You have nice skin, no masses, and no bumps. I'm gonna go ahead and just look at your eyes, and I see that your eyebrows and your eyelashes, hairs, they're all equally distributed. Now I'm gonna take my pen light and I'm gonna shine this light towards the side. I'm gonna check for your left side pupils dilating along with your right side pupils dilating, which they are. I'm gonna go ahead and do that on the opposite side, and I see that your right pupil dilates along with your left pupil. Now you're gonna look at this pen light, and you're gonna follow it side to side, up and down, around town. And this is indicating your cranial nerve ocular motor. I'm gonna have you blink rapidly, and this is also testing your cranial nerve of your rapid eye movement and your eyelids as well. You're gonna go ahead and use your finger, touch your nose, and touch the pen light where you see the pen light 5 times. 1, 2, 3, 4, 5. And now I'm gonna do it in a range of directions, so same thing. 1, 2, 3, 4, 5. Thank you. So now you're gonna cover one of your eyes, and I'm gonna put a number up, and you're gonna tell me what number it is.
2, 3.
Perfect. And now you're gonna tell me when you see my hand.
I see it.
Perfect. Opposite hand, what number?
2. I see it.
Perfect. So now I'm also gonna look at the conjunctiva, and I see that it is of normal color and it's pretty pink. So now we're gonna look at your nose. I see that your septum is intact and your nose is midline, I'm gonna look inside to see the nares, and I see that it is of normal color, hair distribution is equal, and the nasal passageway is patent. Thank you very much. So I'm gonna have you close your eyes. And we are going to test your cranial nerve number 1, olfactory, which is smell. You're gonna tell me what you smell. Yes. Perfect. So now we're gonna move on to your ear. You can open your eyes now. We're gonna move on to your ear, and I'm just gonna look at the general aspect of your ear. I see that it is of color and there are no lesions. I'm gonna pull the pinna up and back. Okay. Now I'm gonna do the other side now. Up and back. Perfect. Now, I'm gonna have you turn to the side and we're gonna go ahead and conduct this whisper test. You're gonna tell me what you hear while I whisper in your left ear.
Pink.
Okay, next ear.
Blue.
Perfect. So now we're gonna go ahead and conduct the Weber and Rhine test. I'm gonna do this and you're gonna tell me if you hear it or not.
I do hear it.
Okay, next ear.
Mm-hmm.
Okay, so now we're gonna see the back of the bony prominence of your ear to see if you can feel the vibration.
Mm-hmm. Yes.
Perfect. So now we're gonna do the same thing on top of your head, Weber test, but we're gonna see if you hear it on both ears.
Yes.
Perfect. Thank you very much. So now we're gonna move on to your mouth. I see that your lips are intact, no crust. Everything is of normal color, no cracks, no blisters, nothing. So we're gonna look at the inside of your teeth, and I see no malocclusion. I see your gums are nice and pretty pink. Now I'm gonna have you open up your mouth, and I'm gonna go ahead and use this tongue depressor and my pen light to see the back of your mouth to look at your uvula, and I see that it's midline and symmetrical. Perfect. Now I'm gonna look at the soft and hard palates, and I see that everything is of normal color. I'm gonna have you move your tongue rapidly, and this is going to test your hypoglossal cranial nerve with the tongue movement. Thank you very much. Now I'm gonna look at your neck. I see that everything is intact, and I see that your trachea is midline. So we're gonna have you move to the side, and I'm gonna go ahead and palpate the trachea side to side, and I'm gonna have you swallow for me. Thank you. And this is testing the glossopharyngeal cranial nerve with the swallowing. Okay, so you can move back to this way. So I'm gonna use these Q-tips, and I'm just gonna test the sensation. Let me know if this feels light or hard.
Light.
Okay, and what about this?
Hard.
Perfect, thank you very much. So now we are going to move on to your respiratory test. So I'm gonna go ahead and inspect. And before we do that, we're gonna do the range of motion of your neck. So go ahead and move your head back and forth. And while you do that, move your shoulders as well. Okay, on to the respiratory. I'm gonna come to the side and just see the lateral side of your spine and your anterior chest. I see that there's no concave, so there's no kyphosis. I also see from back here no scoliosis or lordosis as well. So I'm gonna go ahead and inspect the temperature, and I see that you're warm. Perfect. So we're gonna go ahead and palpate the anterior side of your thoracic cavity. Perfect. And I'm gonna have you repeat the word 99, 99, 99. Go ahead.
99, 99, 99, 99, 99, 99.
Perfect. So now we're gonna do that on the posterior side.
99, 99, 99, 99, 99, 99.
Amazing. Thank you very much. So now what we're gonna do is we're gonna go ahead and percuss. So I'm gonna nice hollow and tympanic sound. We're gonna go ahead and do that laterally on this side in a zigzag motion. Now we're gonna do it the opposite, laterally, zigzag motion. Okay, and we're gonna do that anteriorly. Perfect. So now we are going to also take your respiratory sound. And are you a smoker or have a history of smoking?
No, ma'am.
Do you take any medication?
No.
Okay. So I'm just going to listen to your heart sounds and compare it laterally. Perfect. So we're going to do it laterally on this side. Perfect. We're going to do the other side laterally. And now we're going to do it from posteriorly. Perfect. Thank you so much. I also noticed that I was counting your respirations and they were at a range of 14, so that was of normal range.
Okay.
So now we're gonna move on to your posterior side, and I'm just going to conduct the breathing test to see if the lung expansion. So breathe in, breathe out. Perfect. Thank you very much. You can move to the side. And now we're going to do the abdomen. So before I start, I'm just going to take a broad inspection of your abdomen, and I see that it is of normal range and there's no anything protruding. So I'm going to go ahead and put this down so you can lay flat. Okay. So I'm going to look from this side and laterally, and I see no concave or nothing protruding. So I'm gonna go ahead and listen to your bowel sounds. I'm gonna start from the lower right quadrant and move counterclockwise. Perfect. Okay. Now I'm going to go ahead and percuss. Let me know if you feel any pain. Perfect. So now I'm going to move on to light palpation. Let me know if you feel any pain. And now I'm going to move on to deep palpation. Perfect. So now while you're laying down, I'm going to go ahead and check your vascular signs with the bell of my diagram, my stethoscope. And I'm going to check your apical, your aorta vascular sign. I'm going to check the 2 renal on both sides. I'm going to check the ileum. I'm going to check your femoral and your inguinal. Perfect. You can sit up now. So now what I'm going to do is I'm also going to check your pulses as well. I'm going to start with your carotid. I'm going to palpate it with my 2 middle and index fingers, okay? And I'm just going to use the bell. Okay. Now I'm going to take your radial pulse and just feel it. I'm going to do your brachial. Now we're going to check the femoral. Perfect. Now we're going to look at the popliteal behind the knee. Now we're going to do the one on the ankle, which is the posterior tibialis. And then we're going to do the dorsal medialis, which will be on the shaft of the foot. And then we're also going to do the apical one as well. Perfect. So now we're going to move on. I'm going to have you close your eyes, and I'm going to write on your hand, and you're going to tell me what number I'm writing.
1, 7.
Okay, and what about this?
1.
Okay, now I'm going to place something in your hand. You're going to tell me what it is.
A ring.
Okay. And what about this?
The Weber thing.
Yes. Perfect. You can open up your eyes now. And I'm going to go ahead and test your reflexes. I'm going to start with your legs. Okay. Okay, so now we're going to do your triceps. So I'm going to look at the apex of your elbow. Okay, small one right there. We're gonna do it on the opposite side. Okay, perfect. So now what I'm gonna have you do is get up, and we're gonna do a series of tests to test for your neurological standpoint. So you're just gonna stand like this, and I'm gonna see the balance. 5 seconds, great balance. So now you're gonna do the same thing with your arms out. We're just gonna see any imbalances of her weight. Perfect, thank you so much. So now you're gonna walk to the camera from heel to toe, and back. And this is just checking her her gait along with her balance as well. Perfect. Okay. And I'm gonna have you do a series of range of motion. So you're gonna kick your legs up, move your arms. And while you do this, do you feel any tingling sensation?
No, ma'am.
Okay. Okay, that's good. Sit. And finally, we're just gonna see any type of peristalsis or paresthesia. While I'm doing this, also edema as well. Do you feel any tingling sensation, upper, lower extremities?
Nope.
Okay. And I see no pallor. You said you have no pain. Your pulses are correctly found. No paresthesia and no paralysis. So, do you have any questions for me?
No, ma'am.
Perfect. I'm gonna give you back the call bell. If you need anything, just ring the call bell. And thank you so much.
Thank you.
Wash my hands. Skills complete.